As we've discussed already, and as you know, there were a handful, 5 states to be exact, including my state of Michigan, where my governor required, through an executive order, nursing homes to admit COVID-19 positive patients back in their facilities. This proved to be a terrible policy, as we found out, with the consequences for our seniors, with almost 2,000 nursing home residents in Michigan having died. That's accounting for 1/3 of our state's COVID-19 deaths. Dr. Redfield, some officials in the 5 states that issued these executive orders have indicated they were following guidance from administration. What guidance? And you used that term expressly earlier on, and I appreciate that, because I think that's what we do give at the federal level when we talk to the states. But what guidance did HHS and CDC release as it relates to admitting COVID patients into nursing homes? And secondly, what obligations are states under to follow that guidance?
Thank you very much, Congressman, for the question, important question. CDC did, in fact, and does, in fact, have guidance for nursing homes. The guidance that you're referring to was guidance that was grounded in the fact that some situations were that nursing homes were refusing to take any COVID patients at the time. So CDC did issue a series of important prerequisites that the nursing home had to have in place in order to accept these patients that they had admitted to the hospital back when they came back. Fundamental to that was that they had the appropriate facilities to isolate that individual. They had the appropriate infection control capacity to maintain that. So it really was not saying you have to take somebody back. It's that you have to be open to taking care of COVID patients, provided that you have the capacity to do it correctly.
And correctly is the key thing.
And correctly, and so that that patient doesn't spread the infection to other individuals. And I think some of the speeches that we've heard in the press fail to understand that it's to do it correctly. As you know, over half of the nursing homes in this nation right now, over 7,000 nursing homes in this nation have a COVID patient in them. The question is how to do it correctly and safely.
And save the lives, yeah.
And save the lives.
Well, it gets down to data as well. So let me ask you, what are the obstacles to collecting and reporting the data that you are now requiring, and my governor has finally started to put out? What are the obstacles to collecting and reporting this data, particularly among seniors living in nursing homes, and what steps has CDC already taken to improve data collection from the states?
CMS has now required, as you know, that nursing homes are reporting their data. They report it to CDC, and then CDC reports it on to CMS, and CMS has its actionable. Right as we sit here today, a majority, over 90% of nursing homes, I think it's north of 80. I think we were almost at between 80 and 90% are actively reporting through our system already, since that request was required a couple weeks ago. And we're working to get all 100% of the nursing homes to be reporting as required by CMS. And that data it also is complemented. I mentioned earlier about the ethnic groups and data. That data actually comes in originally with now all testing. You all have helped us in that now any test that's done for COVID has to come and has a series of key data points to include ethnicity and race, so that we can maintain that for all cases across the country, independent if they're nursing home or not.
Thank you. We hope it helps. Dr. Fauci, 3 questions that I have for you relative to yesterday. University of Michigan announced its plans for fall semester to consist of a mixture of in-person and remote classes. As schools prepare for the fall semester, what factors should they be considering? And I'm thinking of higher education here. What do we know about the transmission of COVID in young adults that would help inform the decision to reopen colleges and universities? And thirdly, should reopening look different for a school like University of Michigan versus a school like Hillsdale College in my district with 1,500 students in a rural community?
Yeah, all good points. Again, one answer could probably spill over into each of the questions. You really have to consider what the state of the epidemic is in the particular place that you're at. Now, if you have very, very few cases, like in a small college in a county, I think you can be really very liberal in the opening. What schools are doing, and they're doing it in a very creative way, is to try and make sure that there is separation enough that you have situations where, first of all, masks should be done at all times, without exception. You've got to protect the vulnerables. You've got to allow both faculty as well as students who are in that category of underlying conditions to be able to have the capability of either teaching or learning online. You have to have the capability of, when you get an infected student, which you invariably will, no doubt, to be able to remove that student to a safe, comfortable place for the period of time until they can go back. If you leave them in the community, you're going to wind up having a situation that could make the whole thing fall apart. That's just a few of the things we need to do. But importantly, you've got to look at what the status is in your particular situation. The other thing is, people who work with the students, namely people who feed them, people who clean, they need to be also paid attention to, because often, be it in a cruise ship or be it on a nursing home, it's the staff who might bring in an infection and then infect the individuals who are in a much larger group.
Thank you. I yield back.
Thank you.